Hi, this is KSnow from Maryville University. Today I will be doing my comprehensive physical assessment of my patient Brian Snow. He has already been instructed to go ahead and empty his bladder and take off his clothes and put on a robe. I have already done a full set of vital signs, height and weight, BMI, and a distance vision using the Snellen chart. The first thing I will do is do an overall assessment of his skin and facial features. I will inspect his skin and scalp. I will then palpate the scalp and the facial bones and musculature. I will palpate the maxillary and frontal sinuses. Any pain with that?
No.
Okay. I will then assess his cranial nerves 7 by having you wrinkle your forehead and close your eyes real tight and puff out your cheeks and then stick out your tongue and smile. Okay, great. I will then palpate the temporomandibular joint. Go ahead and open and close and move side to side. Any pain with that?
No.
Okay. I will then check light sensation. Close your eyes and tell me where you feel this.
Forehead, cheek, chin, nose.
Great. I will now go to the eye inspection, and I will be looking at his sclera and conjunctivae and his eyelashes and eyebrows for distribution and any lesions, which everything looks good there. I will then have you I will palpate the lacrimal apparatus. Okay, any pain with that?
No.
Okay, I'm then going to look at into your eyes. I will be then assessing for light reflex and accommodation. Look straight ahead. Good, red reflex. Good. 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 Okay. I will then check for the cover and uncover test. So go ahead and cover one eye. Good. And switch. Good. Checking for light accommodation, any drooping or lazy eye. I'm now going to check the cardinal positions of gaze. Follow my finger, please. Okay, I will now check peripheral vision. Tell me when you can see my fingers.
See him. See him. See him. See him. See him. See him.
Great. Okay. The next thing I'm going to do is inspect the ears for placement, even and symmetrical. I'll palpate the auricles. I will then do the whisper test. Please cover that here.
Baseball.
And the other?
Baseball.
Great. Okay, so now I will then do the bone conduction. Tell me when it stops.
Stopped. Still here. Still here.
Good. Okay, and the Weber.
Stopped.
Great. Okay. I'm now going to look inside the ears, inspecting the external ear canals and the tympanic membranes. Good. Okay. The next thing I'm going to do is begin with the assessment of the nose, and the midline. The septum is midline. Good pink color. Turbinates are rugated. No discharge. Set there. I'm going to then go ahead into the palate, mouth, lips, inspecting the lips. Good. You can then open your mouth, and I'm checking the buccal mucosa on both sides. Hard and soft palate, checking the dentition for any missing teeth, loose teeth, color. Okay, going to have you stick out your tongue. Say ah.
Ah.
Good. And we'll look under your tongue. Excellent. Okay, I'm just going to take a quick look at the light. Stick your tongue out, please. Good. Tonsils, uvula, pillars. Okay, great. The next thing I'm going to do, during that we would have tested the gag reflex as well. He didn't have a very active gag reflex. The next thing I'm going to do is inspect the neck for any lesions, lumps, or masses, which I do not see. I'm going to then palpate. I'm going to feel the carotids one at a time. I'm going to palpate the trachea and the thyroid and go ahead and swallow. Good. Okay, great. I'm checking for any jugular vein distension. I'm going to then have test his range of motion. Look side to side, please. No, sorry, your whole head. Yep, there you go. And up and down. Great. And perfect. Okay. I'm going to have you shrug your shoulders. All right. Perfect. And push against and push against. Good. Cranial nerve 11 is intact. I'm then going to palpate all the lymph nodes, pre and post auricular, occipital, tonsillar, submandibular, submental, right? The superficial cervical chain, deep cervical, and supraclavicular. Good. Okay. Next thing, we're going to look at the upper extremities. I'm going to look at the skin, looking for any lesions or, okay, even hair distribution. I'm going to then check his hands, fingernails, capillary refill. Good. Okay, great. Now, so that's all set. I'm going to feel the radial and brachial pulses. Good. Okay. The next thing to do, we're going to look at his chest. Just going to move the gown. I'm going to look for symmetry, any lesions or abnormal bruising, anything like that. Everything looks okay. I'm then going to have you turn. Going to inspect the back for any lesions. Looks as though he's had a few surgical interventions there. I'm going to then begin to feel for respirations. Take a deep breath. Good. Okay, I'm going to percuss for CVA tenderness. Any pain with that?
No.
Okay, and shoulder symmetry, cervical and lumbar spines are intact. Okay, now I am going to have you do, just say the word 99.
99. 99. 99.
Just testing for tactile fremitus, which there is none. I'm then going to percuss, listening for any change in sound. There's not. I'm going to listen to his lung sounds. Okay, I'm now going to have you turn back around and face me, please. I'm going to do the same thing. I'm going to first palpate for the apical pulse. Okay. Still going. Okay, apical pulse, good. All right, and tactile frematus, go ahead and say 99.
99. 99. 99.
Good. I'm going to listen. Good. Okay. I'm also going to listen for heart sounds. I'm going to be listening at the aortic, pulmonic, mitral, tricuspid, and at Erb's point. Good. And there are no murmurs or bruits. The only other thing I forgot to do with the neck assessment was to listen for any bruits on the carotids. No bruits or thrills. Great. Okay, so at this point, I now will ask my patient to lay down for me. I'm going to start with the abdominal assessment, in which case I'm going to begin. Oh, right, sorry. I need to move the computer. Hold on 1 second. Okay, I'm going to first inspect the abdomen. I'm going to listen first for bowel sounds and arteries. This could take up to 2 minutes. He has normal active bowel sounds. Listen for the aorta, iliac artery, renal artery, and the femoral. Great. Okay, now I'm going to palpate and percuss. So, any pain with any of this?
None.
I'm going to feel the kidneys. Okay, I'm going to ask you to take a deep breath in and let it out. Good. And again. Good. Again. Good. All right, and now I'm going to just ask you to lift up your head only. Good, and I'm assessing for any hernias, which there are none. Okay, so at this point, I would now ask you to sit up. And I'm going to just move the computer again. Plug it back in so it doesn't time out. Okay, that's good. At this point, I will now be assessing his legs and feet, checking for hair, even hair distribution, any abnormalities in the musculature, anything like that, which they are all fine. I will then be feeling for popliteal pulse, dorsalis pedis pulse, okay, good. And I will check feeling for temperature, which they're warm and even. Okay. I'm now going to check his reflexes. Starting with a brachial. Good. Good. Good.
Point that down some.
Good. Good. Okay. The last two things I will have this patient do would be to stand up and do a nice slow squat for me, testing muscle strength. Good. And I'm going to have you turn this way and just bend over and try to touch your toes. At this point, I'm checking the spine for any scoliosis of the thoracic or cervical spine, as well as the lumbar spine. And he is without any. At this point, you can go ahead and sit down. At this point, we would then discuss my findings, and I would solicit and answer any questions. Thank you, and I hope you have enjoyed my video.